Good morning, Alberta, or good afternoon, depending on what time zone you are joining us from today. My name is Ann Snowden. I am absolutely honored to join what has been just an incredible group of speakers in this digital summit. My warmest congratulations to Laura Kilcrease and her team for putting on such a flawless event, and an event at a time I would suggest is incredibly needed. So what I'd like to begin with is what we've heard some number of ideas about today, and that is COVID-19. When you look back and reflect on your career, as some of us may have done, there are one or two events that often you look back and think it really changed the world. Certainly 9/11 was one of those. It changed forever how we travel and a number of events and things at borders. I would suggest that COVID-19 is one of those events that we will reflect on, look back, and really think about how it changed the world of healthcare. Its scope and scale as a public health emergency is beyond what I think any of us imagined. It really shifted very dramatically. We've heard a lot about that with some of the speakers today, how health systems are engaging the communities they serve, the populations they strive to really support in terms of their health wellness, and really shone a very bright light on some critical dimensions of health systems that are most likely needing to change, and that may be supply chain capacity to make sure every citizen and health team have those protective products they need, understand how to use them and how to stay safe, and the number of workforce challenges unfolding really right before our eyes. We have an opportunity in front of us right now, right today. We've heard many important ideas to leverage that opportunity, and that is to think about the ways we can take the lessons learned, the very critical events of COVID-19 that continue to unfold, and rethink how we transform healthcare delivery in such a way that we meet the needs and we support people to stay healthy and well within the unique contexts and circumstances of their lives. So I really want to speak to some of those items today on how digital health engages and supports the health of communities, learning again from what we're seeing unfold in this pandemic. So thinking about that pandemic, just how have health systems very quickly had to mobilize citizen engagement? There is country after country. We all watch this unfold, starting in China, moving right across Europe and into North America. The very profound impact this pandemic has had on the individual lives of day-to-day lives of virtually every global citizen. What we also saw, and I would suggest we need to think more about, is how did health systems engage and support our communities as this pandemic unfolds and as it continues to unfold? When you think about it, we've heard a little bit today about how do we inform the public? What kinds of information do they need? Most of our information today comes from social media, public press conferences, presentations by our many, many very talented public health leaders. And yet all of us live in very digital societies. When we shop online, we do all our travel online, all our banking online, virtually every business sector is digitally part of the digital societies we live in, except perhaps, to the same degree, of course, is our health system. Why is that? And what are some of those opportunities to change that? Which I think is really one of the ways we leverage the transformative changes health system can now achieve. Let's think about consumer culture. One size doesn't fit all, although when you really look at how our health systems have been structured, what incredible work they achieve, which is all very, very important, it tends to lean towards a one-size-fits-all approach in the pandemic. Think about the directives: social isolation, wearing masks, distancing yourself so that you reduce your risk for transmission of the virus. But think of the differential impact of those kinds of direction on different communities. Our seniors, either living alone or living in long-term care, who now must stay in their rooms or can't be visiting and spend time and get the support at that social interaction with families. Think of our teenagers, our young adults out in the workforce. Think of our many families in isolated communities. One size doesn't fit all of those groups, and we're seeing differential responses, abilities to engage, and ability to really make decisions to whether they actually comply with these pandemic directives. Now, public health directives are critically important, of course, to reducing transmission of the virus, reducing the risk that people will become ill, and enabling the capacity of health systems to care for people when and if they do get sick. The success of our pandemic response actually depends on the ability and the willingness, perhaps, of our communities to engage, to follow those rules, to comply. I would suggest they may also depend on the ability of our communities and our very special and unique populations in each community to adapt to those directives, but still maintain that social engagement, maybe online versus in person, or still find those ways of quality of life. We're seeing that often on social media. What I think we have an opportunity for now in the health system is to mobilize and shift from that culture of striving for compliance and move towards a culture striving for collaboration. How do we help those unique groups within our communities and our populations to stay safe, be healthy and well, but not compromise very, very important things like personal decisions for their quality of life and their ability to move through some pretty challenging times that we're seeing. So this one-size-fits-all has been a long and deep focus of our health systems, primarily for very good reason. Disease management pathways informed by evidence. We know that when we engage in certain health behaviors, we get to very important health outcomes. I think now is a time to rethink how do we build on those disease management pathways? How do we better understand the unique life circumstances of the communities our health systems serve and tailor, adapt, and collaborate with those communities to support and enable their health at a much greater level. Now let me switch gears slightly and talk about health workforce. Health workforce is a community. We often don't think of it, and sometimes, and we've certainly seen impressive community response who have realized just how incredible the work of our health workforce is actually achieving under absolutely incredible circumstances. I'm an ICU nurse originally by training. I can't even imagine what my colleagues in those settings are challenged by. But look at some data out of Blue Cross Blue Shield in the US on the health of our workforce. And do we really understand those strategies and the abilities to support the health of a workforce that is yet so critical to the life, health, and wellness of virtually every global population? If you look at this data, you can see a very major decline in health at the age of 27, and this is focused on millennials. Blue Cross Blue Shield looked at what's our future workforce, what kinds of ways can we be supporting their health and workforce. And here we see that in fact millennials, have a very different health profile than either the Gen X group before them, and certainly different again from the baby boomers before that. We see a double-digit increase in the prevalence of 8 out of 10 chronic health conditions since 2014. Our older millennials and the 34 to 36-year-olds have higher prevalence rates for nearly all of those top 10 conditions than their Generation X cohort that is before them. And millennial women have 20% higher prevalence of top 10 conditions compared to their male cohort in this population, mostly contributed by major depression, high rates of type 2 diabetes. So another community and health of that very critical community, in my mind, it turns our attention to the health workforce. If our millennial population is in fact, and this data would suggest as a very large study, significantly challenged by health conditions, then how and where do our health systems now need to turn very clear attention to supporting and enabling our health workforce to be healthy, well, work in high quality work environments that support them to do the incredible and amazing work that they deliver every day to the support of the health of our population. Excuse me. And we've heard quite a bit today about the rapid emergence of virtual care. Virtual care is incredibly important. We've been talking about virtual care in health systems for decades. And many health systems, in fact, did start down the road of virtual care before the pandemic. What's involved very quickly, though, is just how central virtual care now becomes when in-person care is no longer possible or deemed safe in terms of risk virus. Here's the catch, though. How do we know what virtual care is achieving for whom? We've just talked about one size doesn't fit all. There isn't going to be one virtual care strategy, whether it's an online tool, a smartphone application, a remote monitoring system that's going to meet the needs of every population segment or every community that a health system serves. And understanding much more clearly, much more accurately what virtual care achieves for whom, under what conditions it achieves best outcomes, and how does that now become a source of learning to advance and help health systems and the way we're structuring care delivery models to make sure that they are in fact achieving value and they are supporting the health and wellness of our communities. Digital health, in my mind, is not simply digitizing today's care delivery. Digital health is about transforming care delivery to move to where people are, where they need health and support and wellness to be, and leveraging digital tools to make that possible. So let me share a little bit more about what I mean by transforming care delivery, not simply digitizing today. Digital health, according to the Health Information Management Systems Society, often known for many of you as HIMSS, is taking a much different path than health we think of in traditional health systems. They define digital health as connecting and empowering people and populations to manage their health and wellness, augmented and supported by highly accessible, flexible provider teams working within digitally interoperable, digitally enabled care environments. This is a complete shift in healthcare, not just from when you become diagnosed with a health challenge and we work with teams, regardless of what that challenge is, to recover, to manage that health. This is shifting now to building on our disease management focus, pathway focus, towards how do we now help people help themselves stay healthy and well by connecting, empowering them. We heard earlier about transparency and trust. This is just one dimension that digital health from this lens may be able to achieve for our communities. What do we mean by digital health? This is a bit of the building blocks. So by all means, it must have a very strong governance and very strong and supportive workforce able to deliver care within these new digital environments. That is not a small requirement. Governance includes privacy, security, transparency. All of those things contribute to trust, and our trust in the communities that our health systems will be there when we need them to be there. Interoperability is simply the democratization of data. Can I, as a patient, get access to all of my health data when I need it? Because I need that data to make decisions. But it's not just about data. We have massive amounts of data in healthcare. What we may not have are the analytics tools to transition that data into knowledge, into insights for our patients, our communities. That builds health literacy. That helps us understand our health and wellness. What are those indicators that I need to pay attention to do very well and make good decisions to continue my progress? What are the indicators that would suggest, gee, I may not be making the progress I should be, and I need to change and or engage with my provider teams to help me do better. When these building blocks come together, that's when we are able to meaningfully connect to the communities health systems serve, enable people to manage their health and wellness, define their health and wellness goals from within the very unique situations, conditions of their lives. We saw a very troubling challenge in COVID-19. Some population groups have vastly different outcomes than other population groups. So African Americans, African Canadians did not have as terrific an outcome with COVID as their Caucasian counterparts. We need to understand that. We need to mobilize data much, much earlier to start to understand those differences and then zero in on reducing risk much earlier, much more proactively, again, driving towards keeping people healthy and well. What are some of the features more specifically if you were working or you were a patient in a digitally enabled ecosystem? It would be very person-enabled. What does that mean? You have the choice of the digital tools that you want to use, that you define your health goals, that have those digital analytics that inform your progress. Am I moving towards the goals I was hoping to, or am I not? And how might I change and my behaviors or some of my therapies in order to ensure I continue to progress? They're proactive. They don't wait for challenges or risks to unfold. They identify them early, and that's all about prevention. Preventing transmission of this virus is critical in this pandemic and continues to be. How do we mobilize analytics right in the palm of our hand to proactively identify other risks that we may be ahead for us, so it'll cue us to think about how we can shift, make decisions to reduce those risks. And it's also about population health. This is not as we've talked about, it's not a one-size-fits-all. The way we need to think about engaging and working with our millennials to support health and wellness is not going to be the same as our baby boomers, as our seniors in whatever home setting they may be working, and even our young families, children, moms at home, online working, and trying to navigate online learning with their children. There are important dimensions here. They're personalized, they're proactive, they focus on keeping people healthy and well, and they look at what are the outcomes we're seeing in population health segments to make sure we understand, are we achieving the best possible outcomes with all of the various populations we serve? And if not, how do we tailor and personalize care delivery to ensure that we do? Part of that involves very significant digital tools, but it's not just about the digital tools. It's about what those digital tools make possible for people to achieve. Those analytics tools now allow me to track my progress to health goals that are meaningful to me. They may be informed by clinical pathways, but they absolutely start and stop with my decisions, what I want to achieve, how I want to achieve it, and maybe even how I need to achieve it in the community or the population I happen to live in. They cue me, they help me identify. You think about in retail, Amazon tells me what greatest books that I might be interested in because it already knows the ones I'd pretend to find very interesting and helpful. Think about that in the health context. Think about identifying, gee, these are some possible opportunities that you can exceed your health goals, or here are some risks or ways to think about how to mitigate any challenges that may be oncoming. The other thing about digitally enabled health systems is it's outcomes driven. It's not about compliance on fitting along a pathway. This is about, are you achieving the outcomes you want to achieve within those environments, those unique life circumstances, and those communities that you happen to live in. It is not a one-size-fits-all, and it shifts towards progressing not along a pathway, but towards achieving outcomes that are meaningful to every individual. So what does that mean? That means health systems, we really need to rethink what we call patient engagement. Sometimes we call it patient satisfaction, sometimes patient activation, sometimes engagement. But really, health systems need to move from where we are, I think, today, and we heard about that with previous presentations around our access to our health data, our health records, all really important. But that's just access to data. The question is, what do we do with that? We move it forward to adopting digital tools that help us make sense of that data, help us inform our decisions using analytics tools that even flag, are we at risk for not achieving goals or at risk for something that we hadn't thought of or not? So it's much more informational and it's much more personalized to the unique individual circumstances of every person. But it takes one step further, and that is dynamic engagement and partnership. with health teams who are working alongside every individual, making sure that they have available to them all the necessary information. And more importantly, they understand the meaning of that information. One earlier speaker mentioned that it's not about taking all of that data. It's zeroing in on what I need to know, when I need to know it proactively, and having the confidence and the support of my health providers to help me make very informed decisions that are personalized to me. That's when we get person empowerment, and we move beyond simply sharing information to empowering people to stay healthy and well. What that also means is our decisions start to change in health systems more broadly. Today, our decisions, more than often than not, react and respond. We have massive amounts of data. The EMR systems, the digital infrastructure, cleans that data, creates those reports, flows reports to decision makers, whether that's our senior team, our CEOs, our boards, our clinicians. They react and respond, and they do the absolute best to make sure every individual gets the care they need. In a digitally enabled health system, it takes it a step further. It understands the patterns in that data. This is where the machine learning, the artificial intelligence tools come in. It identifies predictive risks. It looks at the historical pattern of patients just like me for the last 5 years, 10 years, or in similar communities. And it identifies what has worked well for them. And it considers those kinds of predictive outcomes to inform decisions now that are proactive and predict what may unfold and to mitigate the risks of negative outcomes unfolding. So we are really moving towards a prescriptive, actionable digital infrastructure, and moving away from what today is a bit more dominant of reacting and responding. Not that we want to wait for people to get ill, but that is the way our system is structured today. You come into your clinical team, you're diagnosed, your care delivery is executed in very, very significant and important ways. But imagine if we knew today those top 5% of every community, they're at greatest risk during a time like a pandemic or during a post-pandemic where economic impact is going to be pretty significant. That's where we are moving towards, and that's where we have digital infrastructure and tools to rethink how decisions are made, informed by data driving towards outcomes that optimize health and wellness. What does that also mean? It also means redefining when we think of value. When we think of value, we want to make sure that every citizen has access to the best possible healthcare. But value is taking on a much broader context, and we've been seeing that in Technicolor in this pandemic. It's about confidence and trust. We are seeing constant changes in how this pandemic is unfolding. It's the nature of pandemics. But are we really connecting in the unique ways we need to be connecting with our communities? Possibly not. This illustration talks about the difference between equality. Does everybody have access to it? Versus equity. Is everyone able to achieve those same outcomes, but may need to achieve them following different paths, different strategic models of care delivery. So care personalized to people and populations is enabled by digital infrastructure that moves us from where we are today, that one size fits all, everyone do our best to get to the outcomes that we know are possible to achieve, to a one size fits one, and really considers the uniqueness of the individuals and the communities we're serving and the very unique life circumstances based in each of those communities. What is the future? The future is about learning health systems. What we're really getting at here is a very data-driven, outcomes-focused health system that understands best what's working for which group of our patients' communities, how are we achieving best outcomes for those populations, looking for the populations who may not be achieving those best outcomes, and then very, very proactively shifting care delivery models to ensure that every community, regardless of what circumstances and situation those communities are operating in, have the opportunity to achieve best outcomes. The only way that is possible is if our digital infrastructure can help our teams to understand what outcomes are we achieving, how do those outcomes inform the design and scalability of solutions to offer those very same best outcomes, regardless of who you are, where you might live, what community, what significant or less significant challenges those communities may be facing. And that's a learning health system, a system able to mobilize data and track in near real time, what are we delivering in terms of care? How is that care achieving value? From whose perspective? Community being a critical one, individuals even more critical. And how do we optimize and ensure that every individual has opportunities to achieve those best outcomes? So we're on a very interesting time. Don Berwick published a paper earlier this year, and I leave this with you. Fate will not create the new normal, but our choices will. What we have seen in communities and their remarkable resilience, the remarkable agility, actually, of health systems to pivot and shift at a time of great uncertainty and very, very significant challenges this pandemic is presenting to us, has shown us that we can learn, and the speed of learning and change is probably faster than it's ever been, and should be and can be more inclusive than it's ever been. That would be motivated and enabled much more quickly, even with greater advancement of our digital infrastructure. The value of standards is something we have long focused on to reduce variation in an effort to make sure everyone has an opportunity to best care available. Now the value of standards is about flowing data across all of the health system, whether you are in a primary care setting, a hospital setting, or you're in a rural and remote Indigenous community which doesn't have access to hospital care or specialist care. It's about understanding the unique life journey, the outcomes that are meaningful to each community and the individuals in those communities so that they define best in the context of the life circumstances they live in. It's about protecting the workforce. I have to say, of one of the outcomes in this pandemic, I think we were going to need to pay a lot of attention to is understanding who is our workforce, how do we help them remain healthy and well, and ensure they have the quality of work environments that allow them to do the impressive and, quite frankly, unbelievable care we see them deliver virtually every day. What's the role of virtual care? How does it now become a new tool in the toolbox to support and enable self-management, helping communities achieve health and wellness, framed and defined from their unique perspectives? Preparedness. Boy, we've learned some pretty important lessons in the pandemic on preparedness. The preparedness for a pandemic, I don't think any of us really quite thought about the scope and scale of what we're seeing today. How does that now teach us about resilience, agility, and preparedness in future? And overcoming inequality. This has long been a challenge, but with a digitally enabled ecosystem that now allows our health system teams and leaders to track outcomes, and it personalizes those digital tools right to every individual so that they now learn and are enabled to manage their health and wellness and very meaningful connections to their provider teams. That's when we achieve the transformative health system of the future, absolutely informed by the very important work of today's health systems and what digital tools really make possible. With that, I am ever so grateful to have had the chance to speak with you today, share some of these ideas and thinking, and I am absolutely happy to answer questions that are in my chat box I can see already. So with that, for a few more minutes, I think we have, let me see if I can respond. Looking forward to shifting towards wellness and digital health rather than simply reactive treatments like the past. It's not that we're replacing, and I want that to be pretty clear. We are building on the expertise and the phenomenal work of today. Those clinical pathways have really been driven by impressive research on demonstrating what works very well. Now is the opportunity to build on those, that excellence in care, and now allow and create those digital societies, digital environments, so that in future, if there is such an event, and I certainly hope there won't be, that we'll have that meaningful connectivity between the communities, the individuals, how systems serve, to coach and support and enable them to avoid transmission of a virus if that's the scenario that's unfolding, or it's maybe just tips and tools and opportunities to stay healthy and well. Let me just see if there are any other questions. Happy to answer them. I'm also very, very happy to respond for those of you who wish to reach out and share your work. Certainly would be delighted to have further conversation. So with that, thank you so much. I'll close this session so you have a moment to take a breath and move on to I think the closing keynote coming up. I wish you a very healthy, safe afternoon, evening, and wish you the best as we hopefully see the end of a very challenging pandemic. Thank you so much.